Hi guys, Dr. Scott here from Select Pain Care, here to answer a common question we get with patients and just the public in general. Why are my shoulders always tight? Why do I always have knots? It's just always a problem. End of the day, I always feel so tight there. Well, we're going to run over a couple reasons why that could be, and it's not always as straightforward as you think. So the first thing we need to talk about is that any force that goes into the shoulders also goes into the neck. So you're going to see that as this shoulder goes up over 90 degrees, we use some of these fibers. So your neck starts right about here. That means load is going into the neck. If the force into the neck means that there's force in the cervical discs, they're going to get compressed with shoulder use. So here's the discs here. So on my little model right here, what ends up happening, if there is enough force in the disc, we go from a nice, almost like a firm mattress of support with the discs, and the more we do this, the more it becomes closer to waterbed. That means degeneration. That means disc bulges. That means radiating symptoms. That means bad news. But the facets can also get compressed with shoulder use. And these are the facets. These little joints back here, they're the ones that get compressed, especially when you extend back like so and so. They allow only a certain amount of rotation. It's why we can't be like the little girl from The Exorcist and turn her head all the way around. They're like little training wheels. But if they get compressed, they will create symptoms of their own. So when the force in the disc is large enough, we're going to get symptom referral patterns like this. So basically, anything from your jaw at C2 all the way down to the tips of your fingers at the lower part of your neck, depending where the force is or where the worst part is, you're going to have different symptoms. Now this could be numbness, tingling, sharp pains. Any and all of these would apply. Aches, this is all possible. But when the facets are loaded, that's when we get these little pains under the shoulder blade. So these dark circles are like deep symptoms, and the lighter areas are just feel a little more superficial. So if you feel it over the top of your shoulder, you're looking at C5, C6, C6, C7 would be back of the shoulder blade, under the shoulder blade, and on up. They all have their own referral patterns. So that means their disc could be healthy, but those facets, even individual facets, are the ones that are really the problem. So this is how we can dial in exactly where the symptoms are coming from. But it's still a lot of information to go through. So what do you have to do? You have to take a detailed history. Okay, this is going to be how long's it been going on? What makes it better? What makes it worse? How would you describe it? A collection of as much data as we can to get a clear picture of what's going on. Okay, the more data points your provider has, the better their diagnosis should be. They also need to figure out what is loaded when the symptoms occur. So if my shoulders get tight when I'm looking at my phone and I'm doing this, well, it's probably a neck thing. But my shoulders get tight when I'm using my arms, well, now it's a little more in that it's a shoulder problem. It's in that column. So getting a collection of all this stuff gives you a clearer picture. Assessing the strength, neurology, joint function, tissue health, that helps too. So if you have the symptoms of L5 running down your back, through your leg, or in this case, C5, C6, and it's over the shoulder, and the strength of C5, C6 is also restricted or limited, now we know, hey, let's really look at that. There's a problem there. So like, for instance, you should be able to touch your shoulders to your head in the plane of your ears very easily. So this doesn't count, gotta go to here. This is an example of left shoulder dysfunction. This person, Jackie, our front desk staff, she has almost full function. This is like 80 something degrees, equates to about a low 90% function in her neck. So if your symptoms are in that area and your shoulder function looks like this, your neck function looks like this, we're going to be more thinking of a shoulder problem. So what does the data indicate? As you see, everything is a measurement. Everything is graded. It's not about what I'm good at. And good at fixing. It's about what is the data telling us that needs to be fixed. Because your body is going to tell the truth. It's not, I can't sugarcoat it and steer it in one direction or the other. There's only going to be one or two right ways to fix something. And outside of that, everything else is going to be really covering up symptoms, or it's going to be ineffective. So, as I said, it is not about the doctor and their ability to fix things. So, if you have something that I can't fix, I should send you somewhere else. If your problem falls into my box, I could say, hey, congrats, you have what I can fix. I can fix it this much. This much will either have to co-care or have to do A, B, or C. That's how your diagnosis, your report of findings should be. I can't fix everything. I can acknowledge that. But you find somebody who thinks they can fix everything. Now you're going to run into some problems. So follow the data. Here's a problem. Sometimes you get a little problem. It looks like this. Boom! Hey, I'm at the chiropractor office. You need an adjustment. You have a subluxation. Hey, I'm at the physical therapist office. This is weak. This is strong. Stretch this, strengthen that. We're good. You need to cup this, cup that. This is what I use. I'm a regenerative medicine. You need a shot here. Guess what? Chemical fixes will not solve mechanical problems. So if they're offering a solution that doesn't match up to your problem, you might not see the results that you want, and you could waste months of your time or thousands of dollars getting nowhere. So what does that mean? Sometimes it's expensive to fix things. Sometimes you need to spend that money in order to get it fixed. But what if you want to try it on your own? You're certainly welcome to do that. First thing you need to look at is body mechanics. Is your keyboard too far from your chair? Do you have poor mechanics when lifting? Do you have repetitive motions at work that need to be cleaned up or could be made more efficient? These are things that we can reduce load and perhaps calm down that injury. Maybe you aren't hydrated enough. Maybe you don't get enough water and there's just inflammation that sits there. Your body just is thirsty and you're not providing that inflammation, or you're not providing that water, and you're going to run into some problems. Maybe your plate is just brown. There's no color, there's no diversity of nutrients. That's also going to be a problem. Rest. Guess what? A lot of our patients are a little older, and they'll say, well, I've been doing the same workout for 20 years. Why is this happening now? Well, your body's 20 years older. You might be able to do the same things in the gym, but your ability to recover from those things has reduced. You need to insert rest days so you can have better work days. That is a fact of life. Father Time, undefeated. Mindset. This is often overlooked. If somebody is always anxious or in a negative mindset, that will literally release chemicals that will cause pain and inflammation. So having that positive mindset, maybe a breathing routine, journaling, any of those things will help. Personally, I have a breathing routine. It's great. I do it after my workouts. I feel ready to go as soon as I'm done with that. And finally, if you try all of these things and they don't work, guess what? You need to find professional help, because it's difficult to fix chronic injuries. And it's often too late to try those things when the problem has reached a certain point. So that's when you need to reach out to someone like ourselves that will provide a detailed exam. You get lots of data, you get the diagnosis that you need and the treatment that you deserve. All right. Well, thanks for watching and learning. Have a good one.